Okay, so we're talking about the rehabilitations. So I think the rehabilitation for the ligament reconstruction is quite important. So our surgery is just about 50% of the success. Another 50% is depending on the rehabilitations. So let's talk about the ACL.
那接下来呢，就讲韧带手术之后的康复非常重要。那我们经常说这个手术是否成功呢？其中一半是靠手术室的表现，另外一半呢就是靠术后的康复。
Okay, so this is the position we do in ACL reconstruction, same like this morning. We put one leg on the post, another leg is putting on the break the tables, reconstructions. Okay. The key is you need to have very anatomic ACL reconstructions. So the post-op, very important. The first day, you need to encourage the patient to have full extensions and quadricep exercise right away. Yeah, core compression, very important. Yeah, and I prefer to release the tourniquet first and dry the joint, stop the bleeding. Okay, so the post-op, the knee swelling will be less if you deflate the tourniquet first, stop the bleeding. Okay.
那除了加压冰敷以外呢，手术结束的时候呢，还有一个操作就是解除止血带之后呢，要吸干这个关节的水，这样才能减少术后肿胀。
The benefit of this deep rest is to make sure that the patient has 0-degree extension. This is the key.
然后支具方面呢，要用这种完全限动的，确保它一直是伸直状态。
Do not immobilize the patient in 30-degree.
不能在30度屈膝位去制动，这是不可以的。
We still see a lot of the ACL after surgery. They put the patient in 30-degree. That is wrong.
我还是看到很多很老旧的方法，就是在屈膝30度位来做术后的制动，这是错的。
Because you will create the flexion contracture after surgery.
因为30度位制动的话，就会引起屈挛缩。
Okay, so keep in mind 0-degree extensions and quadricep exercise, isometric exercise right away.
所以呢，术后第一天开始，非常强调的是完全伸直位固定，要进行股四头肌的锻炼和等长。
You need to see that after the patient exercise, there should be muscle contraction and the patella moving upward.
然后要能够看到股四头肌发力的效果，比如髌骨上
Like this. See? And core compressions.
然后冰敷加压。
Okay? And you can let the patient bend the knee right away.
马上是可以这样子屈。
Okay? But bending is just drop the patient leg on the side of the table.
但是屈的方法呢，就只能在床边这样子稍微屈。
Using gravity to help.
然后还可以利用自然重力。
Okay? And let the patient walk full weight belly.
让他完全负重那样子去锻炼。
No problem.
这个是没问题的。
But make sure that the patient can make full extension.
但是要确保他膝关节能够完全伸直。
If the quadricep muscle is not strong enough, you need the brace to help quadriceps.
那假如股四头肌发力不太好，没办法完全伸直的话，那就要用支具来辅助这个股四头肌发力。
Yeah, but if the quadricep is strong enough, you can let the patient walk full weight belly.
那如果股四头肌的力量是够的话，是可以让病人负重状态下去这种走路。
Very important is that the stance phase. The patient needs full extension. at stand space.
那走路过程中呢，强调的是在步态当中的站立阶段呢，腿是要完全伸直。
Okay, do not overprotect because you will create the weakness of the quadricep and scar tissues.
那如果保护过度，没有进行这些运动活动的话，就会导致瘢痕增生，还有活动困难，还有股四头肌利弱。
Okay, and very careful that the patient get in the toilet because many times the injury is happen in the toilet. 洗手间 injury.
特别要注意，去洗手间的时候呢，要注意保护，因为很多术后再次受伤呢，都是发生在洗手间。
Make sure that the 洗手间 is dry, not slippery.
然后洗手间呢，一定地上不要积水。
Okay, very careful because most of the patient will have problem.
要防止它。
Next step is to make sure that the patient can put the full here, put the hand in. They can make a full extension. There's no gap between the knee and the table and the bed. Encourage the patient to make full extension exercise.
然后要完全伸直，伸直到这个手放不进关节后方，这是伸直位的活动。
Okay, this is our goal of the first week. We need full extensions, and the patient can bend, okay, close to 90 degrees.
之后第一周的内容目标就是让他能完全伸直，也能屈到90度。
Yeah, and we try to use the less crutches. You see?
拐杖呢是我们尽量避免的，不会经常用。
See? And you always ask the patient to make quadricep exercise comparing to the opposite side.
然后股四头肌锻炼呢，就是让病人感受两条腿的这个发力的情况，要让树枝的发力情况跟剑枝一样。
Yeah, so let him see the mirror.
最好就是让他对着镜子去练。
See the mirror.
对着镜子
And
练。
then try to squeeze the muscles.
对着镜子去把大腿发力。
And see the patella movement.
然后观察髌骨的活动。
And tell him that the quadricep will be very small if he didn't do that. The atrophic change will come very fast.
那我们要跟病人强调说，这个活动呢是为了股四头肌的力量，这样他之后走路才比较有力。
And this come back very late, the quadricep atrophy.
不然的话就会股四头肌萎缩或者是脂肪变。
Yeah. So I think everyone have the same problem. After the ACL reconstruction, the quadricep atrophy is always happen in every patient and come back very late. So you need to encourage the patient to make this isometric exercise right away.
我知道 ACL 重建之后呢，股四头肌的萎缩问题还是很多医生经常面临的一个问题，所以在我们呢，我们是强调术后病人要做这种股四头肌等长收缩的练习。
Okay. So after that, you make a progressive range of motions, okay, and strengthening exercise.
在术后3个月呢，是可以做这一种比较多一点的活动。
Yeah. So at this stage, at 3 months, you can encourage the patient to do cycling as possible.
术后3个月呢，就可以去骑自行车。
Yeah, swimming is fine.
游泳也可以。
Yeah. So start to go to gyms at 3 months.
所以3个月就应该进健身房去锻炼。
To improve the knee motion, also the function.
来改善关节的功能和活动的情况。
Okay. And after 6 months, the muscle quadricep should be much better. Range of motion should be full, and he can start to squat.
那术后6个月呢，应该能够达到这种程度，就是活动度可以单也可以单足跳。
Yeah. So at 6 months, the patient should be strong enough, and now you can train him back to previous injury level.
那术后6个月达到这种程度的话，就可以恢复术前的活动了。
Yeah. So this is the conclusions of the ACL reconstructions. So at first 2 weeks, we encourage the patient to pain control, swelling control, make sure that had full extensions, bending up to 90 degrees, start isometric exercise, and full weight bearing. This is the first 2 weeks. Our goal is full extension.
小结一下术后康复的这个进程。那先看术后当天到2周之内，就是最左边白色的部分，就包括止痛、消肿，然后伸直位去用支具，屈膝呢要能够屈到90到120度，要进行股四头肌等长练习，要去能够完全负重，要整个前2周呢，就是确保它能够完全伸直。
Okay, after the 4 weeks, you can remove the breast, okay, and progressive training the balance at the 4 to 8 weeks, okay, full range of motion and walking up down and start to go to the exercise, gentle exercise after 8 weeks.
然后第2到第4周呢就可以不用支具了，然后到第4到第8周呢就可以练习平衡，进行满活动度的活动，还有可以做自行车，还有游泳这些练习。
So after 8 to 12 weeks, okay, you gain full motions, progressive muscle strengthening, normal walking.
之后8到12周呢就继续进行平衡练习、活动度的练习，肌肉的力量锻炼呢也可以在增加难度，要正常行走。
So the last stage is the agility training and able to hop, to jump and sport specific training after 6 months.
那6个月之后，也就是12到24周呢，就可以锻炼它关节反应的灵敏性，还有单足跳，或者是其他的体育活动。
Yeah, but I think the very important thing is the early stage, this stage, okay? You need to make sure that the patient can have full extension. Key is full extension and quadricep exercise at first 2 weeks.
那这些步骤当中，最重要的还是前2周的2方面。第一呢是要能完全伸直，第2呢要做股四头肌力量的锻炼。
Yeah, the next is the PCL reconstruction. So the PCL reconstruction, very important is you need to have a good fixations, and anyway we do PCL reconstruction, how strong we do, we need to protect the PCL more than ACL. Okay?
那刚才讲的是 ACL 重建之后的康复，接下来呢讲 PCL 重建之后的康复。那首先术中要确保固定是够结实的，那另外呢对 PCL 的保护，其实是多于 ACL 的保护。
Yeah, so the PCL will be slow.
也就是说，跟 ACL 的康复速度比起来呢 ，PCL 的康复要慢一些。
Yeah, Dr. Song, you also do the same way? You do PCL slower than ACL, Dr. Song?
这边宋主任是不是也是的呢？
Right. A little bit delay. So for PCL, we protect the weight. We protect the length of motion at the beginning and avoiding. And also the PCL, if you have this kind of breast, should be fine. We call this a PCL breast. You will protect the PCL from sacking down by gravity.
那我们对 PCL 重建之后的保护呢是更加多的，要保护它不要过多负重，也要保护它的活动范围。像这种就是针对 PCL 的支具，可以保护它防止下坠。
Yeah, so the PCL is like the same like ACL, full extensions, isometric exercise, but not full weight bearing. We just put the patient partial weight bearing at the beginning.
那按照这个图呢，我们来看一下 PCL 术后康复，其中术后2周之内呢，大致相同，比如要保持能伸直，要进行股四头肌的等长锻炼。不过在负重方面呢，就只允许部分负重。
Yeah, and also we let the patient move delay. 2 weeks after that, we let the patient move the knee to 90 degrees. So we start movement after 2 weeks.
那活动度的练习呢， 不像 ACL 之后马上就进行的。PCL 呢是要保护到2周之后才进行屈膝练习。
Yeah, and we will put the patient forward bearing after 6 weeks, and also remove the breast. Okay, after 4 to 8 weeks. Let's say 6 weeks after the reconstruction.
那术后4到8周呢，就可以进一步伸屈膝，可以撤除支具。
So the patient will be better, back to normal after 3 months. Okay, and same like ACL, agility training and sport specific after 6 months.
那术后8到12周呢，就能恢复正常的走路。那最后这个阶段呢，跟 ACL 是一样的，包括体育活动、灵敏度锻炼。
Yeah, this is the patient PCL. You see that this is after 2 weeks. We let the patient move. Okay.
PCL 重建之后2周。
And we encourage to not bending the knee on the table, because if you bend the knee on the table, that's the effect of gravity and also the effect of hamstring. So let's do it this way. Drop the leg down, because the deforming force of the PCL is gravity and hamstring. So you bend the patient on the side of the table, you less problem of the hamstring. Okay.
那为了要保护好 PCL 还有腘绳肌腱，那在床旁进行这个屈膝运动的时候呢，就是要保护好。
Yeah. So after 4 weeks, okay, the patient have better motions. Slowly.
术后4周，活动度的练习范围就更广了。
Good stability. So this is after 2 months.
2个月。
Yeah, we encourage the patient to move slower. This is my trick. You put the patient on, using the chair or a step, and put the weight on, like that way.
我会用这种方法。
Yeah, after 2 months.
让他的关节慢慢的负重。
Yeah. Okay. So after 3 months, the patient have better results. 4 months, and this is 6 months. See? So it's a little bit delay for the range of motion of the PCL before you get the full range of motion of the PCL. Okay? It takes longer time.
PCL 重建之后，这个活动度的练习呢是要慢一些的。
Yeah. Okay, so tell the patient approximately about 6 months you get full motions.
所以我们要跟病人沟通好，说他这个屈膝功能呢，要之后6个月左右才能完全恢复。
Many times the patient asks me, "Hey doctor, that guy's operate the same day. Why he's getting much better? I'm delayed. Because that guy is ACL, but you are PCL. You are delayed. Don't worry."
所以有时候呢，就会有一些很有意思的对话，就是一个病房里面呢，一个病人做 ACL， 另外一个做 PCL， 然后做 PCL 那个呢就看到隔壁床那个恢复的那么快，然后就问医生为什么他可以我不行，然后医生才跟他再次解释说人家快的是 ACL 重建，你这个慢的是 PCL 重建。
Right. Okay. So finally he's better. So now we're going to the multiple ligament injury. So this patient, she is the professional national swimmer. She got the dislocations of the knee joint. You see, this is the initial, this is the posterolateral dislocation of the knee.
刚才介绍的是 ACL 或者是
PCL, ACL, and LCL.
那接下来介绍ACL、PCL 和 LCL 3个都一期重建的情况，是个运动员摇滚的发生后外侧脱位。
Yeah, so this patient I plan to do ACL, PCL, and LCL, okay, at the same time.
手术呢是3条韧带重建。
So this technique we propose and publish, we call the minimum invasive LCL reconstruction.
这个手术技巧呢，我们也是写了文章发表的。
So we do this first before the knee gets swollen.
那我们先做上边的这一部分，以免之后关节肿起来就影响了其他操作。
Okay, we go to the insertion of the LCL. We go to the fibula at the insertion of the LCL. Do it minimum invasive way, 2 split incisions, drill from fibula to tibia.
那首先重建的是 LCL， 是通过皮肤上小切口来做的，是从腓骨向胫骨去穿这个胫骨侧的固定点。
Okay, and then we will come for in the joint.
做完 LCL 重建之后呢，才做关节镜下的关节内重建。
Okay, identify the PCL insertions that the PCL we do the tunnels.
这是 PCL 找到支点。
Same like I show you.
隧道就像之前的那个视
Okay, and then we do the ACL.
然后再做 ACL。
Okay, this PCL tunnels.
PCL 的隧道。
Yeah, so our process is to do the femoral tunnel, PCL, then femoral tunnel, ACL, and then femoral tunnel, PCL, and then tibial tunnel, ACL. Okay, that's the sequence.
那我们隧道制作的顺序呢是PCL 的股骨隧道，然后做 ACL 的股骨隧道，然后做 PCL 的胫骨隧道，最后再做 ACL 的胫骨隧道。
Okay, Lisa, you're very good. Good memory. Okay, then we fix both at the same time. As I tell you, this is PCL, this is ACL, right? So you tension this one at the same time in 0 degree. Okay, tension both.
就回到了刚才有一位老师问的 ACL、PCL 同时重建的时候怎么拉紧、怎么固定。那现在左手边的是 PCL， 右手边的呢是 ACL， 两条同时拉紧，然后同时屈关节活动之后，然后同时固定。
Okay, sorry. So this is after the fixations. So this the PCL, ACL fixations. Okay, so this is the A, this is P, right? And after that,
靠前的是 ACL， 靠后的是 PCL。
okay, so after that we come to the LCL. We already make the tunnel, okay? So we use the ultra button to fix the LCL to the tibia.
固定 LCL 也是用 endo button 去
Yeah.
固定胫骨侧。
Yeah. So this is the button for PCL, ACL, and this is the LCL.
然后就看到 ACL、PCL 和 LCL 的固定情况。
And this so this patient, she has the good motions. LCL is negative.
术后活动度是很好的
Yeah.
LCL 的
Lachman
长期
test.
跟进。
Okay, and also the stability after the surgery.
稳定性也不错。
We harvest the hamstring, this side and this side.
所以是
Also,
双侧的
the
都是
peroneus
肌肉
longus.
实现的。
So this 1 month, this is 3 months.
刚才是1个月，现在是3个月。
Good stability.
稳定性很好。
Okay. And peroneus longus function is good.
然后腓肠
We have done hundreds of peroneus longus and we did the long-term studies. There's no problem about the ankle of the patients.
那这个病人呢也取了腓骨长肌腱，那术后检查他躯腕足趾的功能都是很好的。
Yeah,
我们
this
也
one.
做过这个病例随访，发现功能都很好。
Yeah. She's this one. Okay. Now she can back to swim again. Yeah. So that is the rehabilitations for the multiple ligament. So we a little bit delay for the multiple ligament, same like PCL. Okay, we put the breast in full extensions, partial weight bearing. Okay, and at 2 weeks we still put the brace on and we start to move. Okay, to length of motion of the knee. Okay, and full weight bearing at 6 weeks. Remove the breast. Okay, and then after 3 months, 6 months is the same. Okay, so this is the conclusions of the multiple ligament injury, ACL and PCL reconstruction.
那多韧带损伤重建的康复日常呢，跟 PCL 的就有点像，只不过更加缓慢。
So now she's 6 months and she have the very good motions. So this is a goal of the rehabilitation. For the early stage, our goal is to control pain, inflammation, and the tissue healings. Okay. So our second goals for the recovery, we restore the joint range of motion and muscle strength by passive, active range of motion, isometric, isotonic exercise, and the last is to maintenance and return to sports. Okay. So the goal is to improve muscle strength, flexibilities, and proprioceptions. Okay.
那我们把生活康复分成3个阶段，早期、中期和后期的维持以及恢复体育锻炼。那早期的目标呢，就是止痛，还有促进组织愈合。那到中期呢，就是恢复关节活动度和肌肉力量。到后期才进行灵敏度和本体感觉的锻炼，还有它的体育锻炼。
Okay, thank you.